Hello all, this is Dr. Alsup, and now that we have a better understanding of where that parotid gland is located and what are its functions, let's start dissecting this area and finding structures that can be located within the parenchyma of the parotid gland, or in less fancy terms, what is deep within the parotid gland. And if you think about it, that parotid gland is covering a lot of territory, and because it's so big, it necessarily is going to be associated with other structures that aren't functionally, but geographically related to the parotid gland. Okay, there will be three main structures which are embedded within or deep to the parotid gland, and we'll start from superficial and work our way deep. So the most superficial within will be the facial nerve trunk, and its branches that will kind of expand all over this region. Then next, so kind of intermediate, will be the retromandibular vein. And then deepest, and it is quite deep, is the external carotid artery. I'm going to introduce the facial nerve and its two main motor divisions, but we will dive deeper into those specific branches with Dr. Fox in the face session. So the main trunk of the motor root will exit the skull via the stylomastoid foramen, which is going to be quite deep in this region. You can actually even see a little bit of the styloid process right here. From here, the trunk will split into two main divisions. This will be the temporofacial and the cervicofacial. And from there, that's where you'll get that five main set of branches that will serve the muscles of facial expression. There are other branches of the facial nerve as well, or other motor branches in this kind of region, but are going to be more heading this posteriorly or inferiorly. And these include the posterior auricular nerve, which is usually the first branch of the motor root after exiting the stylomastoid foramen, but it's going to head posterior. This nerve will innervate the auricularis posterior and the occipital belly of the occipitofrontalis muscle. And there will also be a digastric branch of the facial nerve, which will efferently serve or innervate the posterior belly of the digastric as well as its close neighbor, the stylohyoid muscle. If you look deep to the facial nerve trunk, you will have a vein of variable size. Typically, it's a relatively short vein before it splits into different divisions. And this is the retromandibular vein. This vein is formed by the union of the superficial temporal vein and the deeper maxillary vein. They will come together and you will have the formation of the retromandibular. Actually, the formation or the coalescence of these two veins occurs within the parotid gland. So you'll actually have portions of the superficial temporal and maxillary veins within the parotid gland as well. But it is within that parotid gland that you'll have the formation of the retromandibular. And then fairly quickly and around the inferior end of the parotid gland, the retromandibular vein divides into two branches or divisions. The anterior, so here's that retromandibular vein. Recall that it's typically a very short trunk. The anterior division of the retromandibular vein will join with the facial vein before these eventually drain into the internal jugular. The posterior division will join with the posterior auricular vein, which is going to be posterior to the ear, to form the external jugular vein. And hopefully we remember the external jugular vein. It's one of those superficial veins of the neck. You can see it running superficial to the sternocleidomastoid muscle right here. Very deep, and always a lot deeper than I am expecting, is the external carotid artery, or your ECA. The external carotid artery is a terminal branch of the common carotid artery, and it is the one that has the branches in the neck, as well as branches to the superficial and deep face regions. And there will be 8 main branches. Some of these we've already discussed, and some will be new to us, but we're going to go through each one in these next few slides. We will start with the branches that come off anteriorly from the external carotid, and these 3 branches are typically the easiest to locate because they are anterior, but also because they tend to be larger in size. Typically, the first branch of the external carotid will be the superior thyroid artery. This one is typically easier for me to locate just because it's the one that's going to descend rather than ascend or move transversely like most other branches of the external carotid. So you can see it descending here. It will supply the superior portions of the thyroid gland as well as portions of the larynx through the superior laryngeal artery. Next, you will have the lingual artery, which may share a common origin with the facial artery, but if it doesn't share a common origin, it's typically the more inferior of the arteries. This artery will supply the tongue as well as some of the suprahyoid muscles. And the facial artery supplies just what you think it should supply, which is the face, mostly the superficial face, but there are some portions of the deeper face, but mostly we'll focus on that superficial face region. There is one medial branch of the external carotid, and this is the ascending pharyngeal artery. This is often the second branch of the external carotid, but it is much harder to see based on its branching point than the anterior branches. It will ascend on the pharynx, deep to the internal carotid artery, and will send many important branches to the pharynx, so that's the main supply. But it will also send branches to the prevertebral muscles, even some small branches to the middle ear, and some small contributions even to the cranial meninges. There are two posterior branches of the external carotid artery, and these are often easiest to locate as they head towards their targets. You will have the occipital artery, which is heading towards that posterior lateral neck and scalp, whereas the posterior auricular artery supplies portions of the scalp and around right to the posterior portions of the ear. So they're going to similar places. The posterior auricular artery will stay a little bit closer to the posterior ear. Last but not least are the terminal branches of the external carotid artery. And the largest of these two will be the maxillary artery, which is not very visible in this particular dissection, but as we begin to explore the deep face and the infratemporal fossa, we're going to spend quite a bit more time here. So this is going to be the dominant supply of the deep face. The superficial temporal artery will continue to ascend. In fact, it's usually easiest to see superior to the parotid gland, and this artery will supply the lateral scalp and the face. So there is a lot going on within or deep to the parotid gland, all kinds of good stuff. Now let's take a moment to review. So question, damage to one of the terminal branches of the external carotid artery would most greatly affect the deep face region too. So damage to which one, I should really ask. Damage to which one of the terminal branches of the external carotid artery would most greatly affect the deep face region? So take a moment. There's a few key things I would look at in this stem. So we are looking at one of the branches one of the terminal branches of your ECA. And it would most greatly affect the deep region. So hopefully you have landed on that C. The maxillary artery is the correct answer. It is both a terminal branch of the external carotid artery as well as the major supplier of the deep face. The superficial temporal artery is the other terminal branch of the external carotid artery but does not supply the deep face, or at least doesn't dominantly supply it. The facial artery also supplies the face, but as we mentioned, it is mostly the superficial face, and it's also not a terminal branch. The lingual artery is going to supply the tongue, and the superior thyroid artery will do what a good superior thyroid artery should and supply the superior portions of the thyroid gland. All right, so that is our review of the contents that are going to be found within or deep to the parotid gland. As you review this, please do feel free to reach out, and thank you for your time and attention.